your personal perspective and your professional opinion, do you feel a pregnant lady needs to be active during a pregnancy? And if so, why? What would be the benefit?
Active, so active with exercise.
Active exercise, active just in general.
Yeah. Oh, yeah. I definitely believe that, you theoretically you should be able to carry on as normal. I mean, there's going to be some activities that you can't do, but there's nothing wrong with walking. There is nothing wrong with swimming. Swimming is very good exercise, and also yoga as well,
Yeah.
especially, a teacher who specializes in pregnancy yoga. So, yeah, and I think those people who were really active beforehand, um, I think it's important to maintain your regime of exercise until you feel that actually I can't do it anymore.
Is that necessarily a point where you would say, if you feel you can't do anymore, that you should stop completely, or should you advise them to kind of seek something else they can do instead of, say, for instance, they were a triathlete, rather seek something else?
Yeah,
Um,
I think you can actually lower your kind of exercise regime to suit your needs at that point.
okay.
But there is no point in overexertion. You are developing a new, you're nurturing to come into the world a being. So, I do believe in activity, but it has to be sensible activity.
Yeah.
And of course, it's good for you. The benefits are great, aren't they? You've got mobility, you've got burning calories. For your mental health and well-being, it's a good thing.
And for the baby, what would you say is the benefits of being active and exercising during birth? Or during,
Well, I think, yeah, during the pregnancy, well, you've got the benefits of being active through the birth. It's going to help you through the birth. It's not going to be, hopefully, a traumatic birth for you, and therefore the transition into parenthood,
yeah,
or into birthing your baby is going to be easier.
brilliant.
Nutrition is the key to sort of nurturing your baby inside you, really. And exercise is going to help with that, really, isn't it?
And these ladies who you see as active and fit, do when they come and see you, do you feel they complain less about, say, for instance, back pain or kind of pregnancy
Yeah,
related pain?
yeah. Yes, I think you're right there. I think they do kind of, um yes, they have less, oh, this hurts, that type of thing.
Now,
Yeah.
what are the most common issues that you have seen over the years in your practice in pregnant women that you believe could be solved through the correct physical exercises?
So we get a lot of lower back pain because of the weight of the baby, and our postures are really poor.
Yeah,
We get a lot of SPD, and that's all. And your joints are loosened, and if the baby's in the wrong position, and that kind of disrupts the your pelvic base, and that can sort of really be a problem for pregnant ladies. Again, you've got a whole wide spectrum of that. Some days it'll hurt, some days it won't.
yeah,
Some women will need crutches, some won't need crutches. Okay. And of course, sleeping is a huge issue for these ladies because they just can't get comfortable, really. And actually, if they do get comfortable, then eventually that becomes sore, and then they have to move around, and that's all very, very sore as well. So
yeah.
it's just very, 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 very uncomfortable.
Yeah, you've actually touched on the next question that I wanted to ask about conditions that you feel would benefit from exercises. So you mentioned SPD, lower back pain. Um, any ladies with controlled blood pressure issues?
You've got the bladder, sort of control as well. Some women who've had a lot of, well, not a lot, maybe one or two children before, very often they will struggle with, a little bit of incontinence through the pregnancy as well.
Yeah, I
So,
think that's one of the big things that most ladies miss is if it's your first pregnancy, great, you've still got nice, good pelvic
yeah,
control.
so
But when it gets
have
to
a
your
second,
second and third, it's almost like if you haven't
forget
focused on it and
it.
if you haven't put the time in it, you are going to lose
Yeah,
it. Um,
yeah. And
and
actually, they've got the problems afterwards as well. So not only have you got probably a few problems in pregnancy, you're going to get the problems afterwards, because after your first child, I always say nothing goes back after your second one.
oh, I think from my opinion as well is and personal experience that um, having the first child I don't think I was as zoomed in on doing the exercises and making sure that I keep myself as fit as I did with the second one. And I think I felt so much better after the second one compared to the first one, just because of the
Yeah.
fact that it was kind of, I was aware of the fact that I would need to be kind of focused on the pelvic floor. I think I was up and about much quicker than after the first one. I think the first one is a bit of a shock and you don't quite know, should I do it, should I not? Um, but I think that was the advice actually you gave me is when I saw you for my last visit, is you said to me, just make sure you focus on your pelvic floor because your second baby is a lot kind of stretchy. Things give a little bit quicker. So just make sure you kind of pick up on that. So that was good advice.
Would encourage activity for someone who's got a breech baby, because actually it would help the, well, theoretically it should help with the rotation of the baby, actually, to be honest.
Yeah.
And if you
And
take that
speaking from
as a
personal
mold,
experience again, remember
oh
I had a
yes,
bridge, yeah?
yes,
So
yes, yeah,
you basically
absolutely.
you listened to a heartbeat right underneath my xiphoid, so right underneath my chest bone. And you just said to me, get moving, make sure that you move. Um, and stand on all fours and things like that. And she did turn
Yeah,
in the end. So
she did.
yeah.
Yeah, yeah, she did, didn't she? Yeah.